It is time for another Y107 MU Healthcare Ask the Expert podcast, and we want to get your feet and ankles and everything ready and in shape for spring and summer. All the great trails and ball games, whatever, just running around with the kids or grandkids. MU Healthcare podiatrist Kyle Fiala is here to help us stride into spring healthy with our feet and ankles. Doctor, what are some of the most common foot problems that people tend to blow off or ignore?
So I think in the spring, the most common things that we see is usually overuse injuries. The weather's getting a lot nicer. People want to be more active, get out on the trail. These kind of couch to 5K things are very popular. And a lot of times this can lead to overuse injuries. Things we typically see would be stress fractures, plantar fasciitis, or tendonitis, which can be frustrating because a lot of times these can be kind of some nagging injuries that kind of can take some time to recover and heal from. So that can sometimes lead to a little bit of some frustration or a little bit of setbacks. But I would say that's probably what we see the most. Another thing that's very common, a little bit more important, is calluses, blisters, cuts, and scrapes, especially if you're diabetic or have neuropathy, which is kind of numbness in the feet. This can turn into a big problem like infections and potentially has the potential to make people very sick, which could lead to them being in the hospital or even sometimes amputations in worst cases. So it is kind of hard sometimes as we get a little bit older to check our feet or look on the bottom of our feet, but it's important to kind of do that, especially if you are diabetic or have numbness. Have a friend, a family member, anybody kind of periodically check that to avoid some bigger problems.
How important is the type of shoe you wear when it comes to foot and ankle health?
So the type of shoe is very important when it comes to your overall foot and ankle health. Our feet are our foundation. Everything starts there. So you want kind of a well-fitting, stable, and supportive shoe, really try to kind of power you through the day. If you don't do this, this can potentially lead to problems in the future, such as overuse injuries, soreness, tendonitis, blisters, and sometimes even deformities. So it's a very important part. I always recommend going to a really good, reputable shoe store. Sometimes those little small mom and pop stores are able to give you a little bit more unique one-on-one service than kind of the bigger box stores or just even buying something online. And here locally, there's some very good shoe stores that we would recommend if you want to get in touch with us.
If you're hurting and experiencing foot and ankle problems, call MU Healthcare's Missouri Orthopaedic Institute at 573-882-BONE. That's 573-882-BONE. How do you know when you need to see a doctor for foot or ankle pain or discomfort?
I would say anytime is a good time. We are always happy to see patients whenever we can. Sometimes patients are just curious or just have questions about things like bunions, hammer toes, or my ankle really hurts when it kind of bends or moves, or why their foot does this or that at certain points. And sometimes they're just looking for more information that they can't get online or from friends or neighbors. And then I would also say that if they're having pain or discomfort that really doesn't go away after a week or two, or if the pain really increases pretty quickly, that would be a really good time to be seen.
Why should someone choose MU Healthcare's Missouri Orthopaedic Institute?
I would say the first reason is our people, or the people that work there. We have an amazing culture at the Missouri Orthopaedic Institute, and we have worked very hard over the years to kind of create and foster that culture. And everyone from the top down is completely committed to providing excellent, compassionate, patient-focused care. I think we strive to treat our patients like family, which sets us apart from other places or facilities. And I'd say the second reason would be our facility. It's rare to have a complete orthopedic care all in one place. It's really a state-of-the-art facility from the clinics, operating room, inpatient floors, radiology, and physical therapy. It's really, truly a one-stop shop.
What are some of the risks if you put off seeing a specialist when you do have a foot or ankle issue?
Yeah, I think some of the bigger issues would be, again, if you get a cut, a sore, a blister, something that you might think is kind of very trivial or small, that can lead to a really big problem, such as infection or even amputation. But a lot of the long-standing deformities, let's say you have a really, really flat foot, or maybe you've had an injury or a trauma and had some surgery before that just keeps kind of breaking down and it's just not really getting better. And that can kind of turn into maybe a bigger problem. And I always say that smaller problems are easier to take care of than bigger problems. So, if there is something there, pretty easy sometimes just to come in and even just have a quick little checkup or evaluation. And it might stave off some bigger problems in the future.
A lot of people love wearing flip-flops, obviously during the spring and summertime. Can those cause problems for your feet?
I would say yes and no. I always love a good flip-flop, especially when the weather is nice and you're being outside and, you don't want to have your feet all cooped up. But I would say for the most part, flip-flops are not going to cause any major problems for most people, especially you're not having any issues or problems to begin with. And I always say moderation is the key. It is totally fine to wear flip-flops occasionally, but it's probably not a great idea to wear them every single day or for long periods of time, or if you're going to be out very active, walking many, many miles. This could lead to those overuse injuries like stress fractures, plantar fasciitis, soreness, tendonitis, or even blisters. There are several companies now who make very supportive orthopedic style flip-flops compared to the very thin, spaghetti strap kind of flip-flops that, probably we had growing up. And so if people are interested, we'd be very happy to discuss those in person. They can absolutely make an appointment, or there's a lot of information online that patients can look for too.
If you are experiencing foot or ankle problems, call MU Healthcare's Missouri Orthopaedic Institute at 573-882-BONE, 573-882-BONE.